the Medical Science Award.
I'm a sexual health clinician, and my research has been mainly been around trying to better understand why we have such high rates of chlamydia in New Zealand and what can be done about that. Comparing our data with other countries can be quite challenging because we collect data in different ways. So, for example, for infections like chlamydia and for gonorrhea, we report every single positive case that's detected at the laboratory level. I was involved in a study where we looked at getting exactly the same data from 6 different countries, so we could do a much more reliable comparison. We get to claim the chlamydia crown for all of those 6 countries. Now, partly some of that was testing, that we were doing more tests than any other country. It was such a surprise for me because Sweden is held up as a country that does a phenomenal number of tests, as is Norway, but we were doing more. So it was the first time that anyone had done that comparison. However, when it came to the complications, we had higher complication rates. So one of the challenges has been that sexual health isn't a priority. So it might be a priority for young people. For young people, it's often the first experience that they've had of loss of health. But because of the stigma and the shame attached to anyone saying that they've had a sexual infection, there isn't a patient voice, there isn't an advocacy group. So we find that so clinicians involved in this area and having to advocate on behalf of patients. So the other countries felt that they were finding the infections and then managing them well, and the difference was that there were issues around our management. A lot of it is there's systems issues about whether or not people can get back to their doctor, whether or not people get their antibiotics, whether or not their partners come along. New Zealand men seem particularly reluctant to go to the doctor. Looking at the complications, young women are more likely to have reproductive complications if they get reinfected. So something else we wanted to do was look at the reinfection rate, and that's really high. If, for example, I was to give a young woman treatment for chlamydia today, I know that there's a 1 in 5 chance that she'll be reinfected within 6 months. What intrigues me is that the reinfection rate, that surely we can do better. I guess ultimately my goal is that that young people can have a positive sexual health rather than all the sexual ill health that we're seeing at the moment.